Hello guys, my name is Dr. Kirtis Tiwari. I am here to talk about World Kidney Day 2023. The theme for this year's World Kidney Day 2023 is Kidney Health for All, Preparing for the Unexpected and Protecting the Vulnerable. Vulnerable. Who are all these vulnerable people? These are people who are at the risk of developing chronic kidney disease or acute kidney injury. So there can be various causes for this kidney damage. What are these causes? Firstly, it can be genetic or it can run in the family. Then it can be various infections like hepatitis B, HIV, hepatitis C that can damage our kidneys. And it can present in like different forms in different age groups. Like in children it presents as nephrotic syndrome, in adults it's which is a milder form, and in adults it presents as FSGS, which is slightly more dangerous, and in elderly it presents as membranous nephropathy. We do not need to know the detailing of those things, but we need to know about the main cause that really leads to most of the cases of kidney failure, that is chronic kidney disease, and that is diabetic mellitus. Our country, India, is known as the diabetic capital of the world. Diabetic nephropathy is the leading cause of chronic kidney disease worldwide and in our country as well. So, to prevent this complication, we have to do the early diagnosis and treat the diabetes mellitus as early as possible. So, how do we treat it? First, we have to diagnose it. Diabetes as a disease presents with really vague symptoms, and most of the times it presents with no symptoms at all. It is really inappreciable. So if you have a family history of diabetes, you should get diagnosed. You should do the test for the diabetes as early as possible. Even if you do not have the family history, even then you should get diagnosed for diabetes as early as possible. There are many risk factors for developing diabetes. First of all, it's the central obesity. Central obesity is more dangerous than your the whole waist obesity, because it's a common risk factor for developing diabetes. And plus the sedentary lifestyle that is prevalent in most of our countrymen, that is eating a lot of junk foods, consuming more fat, more carbohydrate, and there are lesser proteins in our diet. And then there is smoking, alcohol. All these things, they add up and they contribute a lot to development of diabetes. And then by the time we know that we have a diabetes, it has already led to too many complications. Diabetes is like a slow death. It damages our heart, eyes, our kidneys. In here we will be restricting our discussion to the damage that diabetes causes to our kidneys. So how can we diagnose this diabetes? We have to get tested for the blood tests like fasting blood sugar, postprandial blood sugar 2 hours after food intake, and there is glycosylated hemoglobin, that is HbA1c. While we are drawing the blood for the diabetic test, we can also draw the blood for liver function test, and another important test is renal function test, that is a test for your kidney function. These are sodium, potassium, urea, creatinine. These are they accumulate in cases of kidney damage. Also, we should get tested for urine, microscopic examination, and culture sensitivity, especially microscopic examination, where we can get the appearances of glucose and protein in urine if our kidney is not functioning properly. Another valuable test is urine albumin creatinine ratio. That is a very good indicator of our kidney function and helps us diagnose if there is anything wrong with our kidney or not. So after diagnosing diabetes, we move on to the treatment part. How do we treat it? Lifestyle modification forms the cornerstone in the management of any disease, be it diabetes, be it hypertension, especially diabetes. We have to inculcate good feeding habits, like we have to include oats, barley, rye more in our diet and include more protein. And we have to lessen the amount of junk food, we have to lessen the smoking, alcohol, and we have to make aerobic exercises routine in our life. That is a daily part of our life. That is really important. It can decrease the risk of these complications, these eye complications, kidney complications, to a great extent if we are aware. Like even a half minute brisk exercising, like brisk exercising means walking fast, fast, like that for 30 minutes daily, in the evening or in the morning time, whatever is preferable for you. That provides a hell lot of benefit, uh, for limiting the complications of diabetes. Then if if we are not able to control diabetes with the help of our lifestyle modifications, then sadly we have to move on to the drugs, that is medicines. And they are like really good medicines for the diabetes, but slowly and slowly, when diabetes damages your kidney, then the medicines which are beneficial for you, they turn out to be functioning against your kidneys, because most of them have renal elimination, that is, they are eliminated by kidney. So when the kidney is not functioning, there is no use for giving the drugs which are eliminated. There is no use for giving the diabetic drugs which are getting eliminated by the kidney. So it's really important to limit the disease and be compliant with the medication if you are on medication for the diabetes. Also, the important functions of your kidney are basically, as most of us know, even then I'll tell that it's like filtering the toxic substances, that is urea and creatinine, removing the toxic substances from our body, and regulating the blood pressure. That is, when our blood pressure gets altered in case of shock, in case of hypotension, in case of when we lose a hell lot amount of fluid from our body, like in case of sweating, in case of diarrhea, in case of vomiting, then kidney plays a very important role in management of our blood pressure. So when kidneys get damaged due to diabetes, it leads on to something called secondary hypertension. So we should also be regularly monitoring our blood pressure by a physician or anyone we know, any pharmacist we know in our area, and get it regularly checked to get our kidney functioning checked, right? So if unfortunately the patient develops a kidney disease, then the treatment for kidney disease consists of transplantation and dialysis. Even those treatments have their own complications, right? Dialysis for example, I had a patient, when he came back from dialysis in the medicine ward, then he developed a complication, like he became unconscious, he went into shock. So there are various complications of dialysis, like cerebral edema, hypotension, dialysis disequilibrium syndrome, and all these things. Even in case of transplantation, which is better than dialysis, the patient has to remain on a lot of immunosuppressants that lead on to the risk of developing infections in the later part of the transplantation. So, and the risk of graft rejections and all that. So both these treatments have their own complications. So it's better to go till that stage and limit the stage wherever we can with the help of our lifestyle modifications, and aware approach, right? We should be aware about these things, right? And careful, right? So that's all I had to say, and I hope I can spread the message and prevent this deadly disease, which is really a preventable disease if we are really adherent and compliant with our lifestyle and medications, right? And diabetic medications and all that. So as summer is knocking at the door, I think we should be drinking a lot of water, because that is really beneficial for our kidneys. And drink as much water as you can, and just for God's sake get tested for diabetes if you have all these risk factors, and even a family history. Even if you don't have, just get tested for at least diabetes, and get your blood pressure checked, because that can prevent this kidney disease, which is a really bad disease in the long run, and protect your kidneys, which are a very vital organ in your body. Thank you.